Welcome to a recent interview that I shared with a local alternative care practitioner, Todd LeCesne, who I really think of as an absolute futurist. That is someone that's taking full advantage of the synergistic potential of conventional healthcare and cannabis therapy. I hope you enjoy. I could respond to so many of those points. One, yes, the types of demographic groups that are increasing their cannabis usage tends to be older adults, as well as patients with chronic illnesses, which are very appropriate demographic groups to start experimenting with cannabis for the first time. This whole notion of sort of specializing, or at least focusing on the therapeutic potential of cannabis, is right on the mark. There's no other medication that I'm aware of or that you're aware of that has such a wide therapeutic potential for treating potentially so many different types of conditions. And we have this data. Another thing I think is pretty cool about cannabis is it's relatively fast acting with relatively minimal severe negative side effects. There's common side effects, but they tend to be dizziness and confusion, where are my keys and so forth. But certainly the organs aren't failing as a result of exposure to cannabis. And then likewise, again, the reason why I think that you are so particularly interesting is that you are embracing the supplementation or perhaps substitution of cannabis from some of those conventional practices. And it really speaks to what I think of and I tend to describe as a secondary victimization that we're experiencing in our society, whereby not only are we suffering from these three major epidemics, chronic pain, depression, and anxiety, but oftentimes we're leaving our doctor's office disappointed from the sheer lack of efficacy or, the exorbitant number of side effects that are oftentimes intolerable, that we feel like, are creating a worsened life for us. So there's so much opportunity for us, I think, as a community to enhance our subjective well-being, to treat ourselves more effectively, and ultimately to embrace potentially more efficacious types of medications that might be available out there. Something that I struggle with personally is sort of coming out of the closet, I guess, in terms of, I call it coming out of the weed closet.
Absolutely.
And, personally, I had to wait till I got tenure because they wouldn't have promoted me. I wouldn't have been able to get a job if I focused on this as a graduate student.
Absolutely.
And really, I didn't intend to get to this space, but I just think that fate led me here, and I'm doing what I'm supposed to be doing, which is just trying to help people through these means. Have you, I'm sure you face the stigma. I'm sure you face some of the kind of disgust looks, or perhaps a little bit of, space that you now find yourself, that you now find between you and some of your former colleagues and so forth. I don't know if you could speak to any of those types of experiences.
Yeah, absolutely. And the answer is there's been a lot. You're right. It is very much a declaring, an event of declaring yourself. And coming out and saying, hey, I'm on the side of pro-cannabis. I heard somebody say once too that people that don't have an interest in cannabis is only because they haven't had a loved one who's run out of options and haven't had a loved one who's been faced with there's nothing else that we can do to help. You think about the mom who had the child with intractable epilepsy with 20-some seizures per day and had been to multiple neurologists and so forth, ends up having to move to Colorado, where Colorado was more progressive and the first state in the union to really legalize marijuana and cannabis and offer therapeutic options that weren't as available widely as some other states. And she started this medication and found instant relief for her son or daughter, whoever it was at that time. So back to your question of declaring yourself. Yes, I've faced some of those looks from my colleagues. I think that this is one of the reasons why I've gone to such lengths to create a practice that substantiates my desire to promote the evidence-based approach to cannabis first. One of those things that you want to do is be taken seriously. So how do you be taken seriously by your medical colleagues? You're taken seriously by, number one, following clinical practice guidelines, letter of law. Number two, some sort of medical evidence and looking to evaluate the literature and the medical evidence so that you can get as close as you can to answering those questions with some clinical data and support behind it and so forth. Three, I think about how you talk about cannabis, for example, and what kind of verbiage that you use. And that goes back to when this guy came to me and said, "Hey, you're the CBD guys." We're not the CBD guys again. We're a medical clinic first. And I think that when I approach this discussion with my colleagues and let them know that this place is available to refer your patients to, and that we're going to do it the right way on this side of the desk, just like when they would refer their patients to cardiology or to GI or to neurologists, any of these other subspecialists. Those subspecialists evaluate the patient, offer their recommendations for care, in some occasions would initiate treatments, and then they'll correspond back with that referring provider. So we do the same thing here with regards to when we're going to initiate, if we're going to initiate, if the patient has an appropriate indication to receive, if they're receptive to receiving cannabis-based therapies. The other thing that's important for us to say over here too, if we're going to be titrating medicines up and down, one of the differences between our clinic and what you see when you drive up and down the street with regards to all these super flags and signs and head shops and whatever else it is that says CBD is sold here, those persons can't do anything to adjust your medications as you maybe would talk with a clinician who has a license to be able to advise, yes, we can go ahead and titrate down on this seizure medication or this Parkinson's medication as we introduce another therapy and we try to titrate up on that. So we can also do those lab studies to make sure that there's no interactions with medications, that your lab data is not adversely affected by initiating a new medication. That's, to me, the way that, and I know that we're going to talk about this in another portion of the interview, but that's the way that I feel that the industry should be moving with regards to legitimizing cannabis as a medication. When you go to a non-clinician for medication, by definition, that's not exactly how it's supposed to go. I understand that there's plenty of persons who don't necessarily have to have a medical license who can, advise you appropriately on supplements and exercise and activity and lifestyle and things like that. But when it comes to a medication and the other medications that you're using, somebody has to actually have a license to advise you on how this is going to go or not go. And that's, I think, one of the differences that we provide at this clinic over here.
Thank you for watching this part of our interview. We truly hope that it helps as many people as possible, including some of you practitioners out there that are still open-minded and want to be able to utilize as many tools and resources as possible to continue to enhance the well-being of your patients. If you appreciate the content that we're bringing you nearly every single day, please consider hitting the like and subscribe buttons or sharing these videos with your friends and family. Consider becoming a Patreon to this channel or even a donor to the University of New Mexico Medical Cannabis Research Fund, where we are working very hard conducting cutting-edge research every single day using all kinds of different types of research designs, working with humans, animals, large data sets. We do it all, and we're working really hard essentially to improve the well-being of our community. Through these efforts, collectively, together, we're starting to feel it. We're changing the world.